Paymaneh. So here are a few exercises that you can do. This is some of the stuff that I do to kind of get me unstuck, so to speak. A lot of this stuff is Nikki. A lot of this is her stuff, and then hybridizing her stuff, kind of the philosophy, or the how, what's going on, understanding a little bit of what's going on, and then how to kind of correct it. Again, this is some of the stuff that I do. If any of this kind of contradicts what Nikki has you doing, I would default to what she's got you doing, or if she thinks some of this stuff, is somewhat contraindicated, then default to what she has you do. This is just kind of what I do. The first thing that one of the things you can do is bear this in mind. So this. If we're assuming this is what's occurring, and this is again based on Nikki's diagnosis and a little bit that we've done, a testing that we've done for you, and just observation. If we're having this left rib flare, what's really happening is it's not just this is kicking out, it's really there's a rotation occurring, right? So that rib cage is kind of going here, right? And what tends to happen with this as well is the pelvis, if we're looking at it from the front, is going here. There's a tilt on that left side. There's an external rotation on that left side, and so this becomes expanded, and this back here becomes compressed. So this is compressed. This is expanded, and because of the way the body is, this kind of three-dimensional model, tensegrity model, what happens is it's going to be the opposite on the other side, typically. So if this is expanded here, what's happening is we're going to compress over here, and it's going to expand over here in the backside, right? So compressed here, expanded here, compressed here, compressed here, expanded here. So what we want to do is kind of reverse that. Right, so one of the things that this is again what I like to do, and please bear in mind I am no rehab specialist, but this is just the stuff that I've learned over the years with Nikki's help and others to help me get unstuck. I'm going to start off with this ball, and with the ball on this side, I'm going to put it underneath my low ribs, in between my low ribs and my hip, right, and just lay on it because I want to kind of reduce the tone, the tension of that muscle, those muscles, right? And what you can do is you can kind of move around a little bit. Just be careful, be gentle. This is a very soft, foamy ball, right? So nothing hard. And I just kind of work into that, those obliques, find some tension. If I find some tension, I'm just gonna sit there and breathe. Try to get that to release a little. Again, just be gentle with your tissue here. Just kind of hunting for just tense areas. Right, so I want to get that stuff to soften up a little. And then I like to go over to this side, and I'm going to put it on my low ribs. Again, just bear in mind this is a very soft ball, and so I'm not putting a whole. You don't want to crush your rib cage, but I'm just going to put pressure on that rib cage to kind of push it back a little. Right, to kind of get that rib cage to depress a little, so I can get breath into that area. So I can get. What tends to happen is that when that rib cage flares, that diaphragm pans out like a drum head, and it becomes less responsive. Nikki probably has you do like a cough and flick, right, where you're trying to stimulate that diaphragm to activate. When we kind of compress that rib cage, it just allows, it takes that tension, that pull, that tautness, that tension out of that diaphragm, and it can become a little bit more responsive. So what I like to do is, again, kind of place that on my low ribs, just be gentle, and then try to breathe into it. Right, just relax. And what I'm thinking about doing is breathing into the back side of my lower left rib cage. And just going for a couple of breaths there. Then, what I'll often do is and we've done this I think before, where I'll just do a left rib grab. So I'm gonna stack this way. I'm gonna, stack my knees right on top of each other. I'm gonna put a tuck in the pelvis, pin these knees down, take this hand, place it on my rib cage, keeping that tuck, thinking about that left rib cage going back, and I'm just gonna, you may want to put something underneath your head. And I'm just gonna focus on that breath. What I'm trying to do is rotate from the spine, and that's why keeping the knees really kind of above the hips and together is key, right? And just try to breathe into that left lower rib cage quadrant. Just going for a couple of breaths. Now, what I like to do is, since I'm on the floor, I'll do some of these marches. And again, you don't want to think about this as an ab exercise. It's really a breathing exercise. And all I'm trying to do is challenge our ability to stabilize the ribs and stabilize the pelvis. Ideally, I'd have a pad underneath my head right now, tail slightly tucked, back flat, rib cage down. You've done this, we do this much more extreme with your legs straight. But again, especially with that flaring, I wouldn't put yourself under that much pressure, and I would really focus on, again, especially on this side, breathing into this quadrant. Start the breath, feel that expansion. Once you feel this all expand really into that thumb, right? Lift the foot and see if you can do it as smooth as possible, right? Because what wants to happen is exactly what's going on with this, and that rib wants to flare. What you're trying to do is optimize the alignment, use your breath to expand, and then see if you can stabilize that without over bracing, right? So again, start the breath, feel that expansion. Top of that inhale, lift. Exhale, lower. Start the breath, feel that expansion. Now you could just do that one side, because that's where it's really going to be challenged. And I would alternate. I'd keep it pretty low key, right? Do like 5 to 8 of those. If you want to, and if it doesn't, you can do the bridge variation, right? Same idea, just bringing the feet in a little bit and back a little bit. We're gonna bridge on up. Same idea, stacking ribs and hips. Here, really think about breathing back into this. I almost think about breathing into my sacrum. Start the breath, but notice again, this is what tends to want to happen. I want to keep these things lined up. Start the inhale, feel the expansion. Wait to feel that expansion. Once you feel that expansion, lift the heel. Exhale, lower. Same thing, I would march this. Start that inhale, wait till you feel that expansion, especially on this left side. Once you feel that expansion, lift the heel, exhale, lower. And if you feel like you can't stabilize it, come back down and just do the march. Then, what you can do is, one of the things that you have, one of the things that helps keep that rib cage back is a muscle called your serratus anterior. It attaches on the inside of your shoulder blade, right? It attaches on the medial border, or the border of the shoulder blade that's closest to the spine. And I got cut off because I just got a notice that my battery was low. But to go back to the serratus anterior, so the serratus anterior is a muscle that's it attaches on the inside border, the medial border, which is closest to your spine. So the medial border of your shoulder blade, on the inside of your shoulder blade. And what it does is it helps keep your shoulder blade adhered to your rib cage, right? It also keeps that rib cage, it also rotates that rib cage to the side that it's attached to. So on my left side, it's going to rotate that rib cage to the left when it contracts if I'm planted, right? So one of the things that we can play with is, and this is something that I like to do, is I'm going to take Because we want to position things a little to the left, I'm going to take my left knee on a pad and put my hands down. And what I like to do is take this right hand, place it on my rib cage. I'm going to post that left hand down through the floor. Now I don't want to post so hard that my shoulder elevates. I want to keep my shoulder fairly neutral, but I'm going to push the floor away. I'm going to let my back round a little bit, and I'm going to really think about pushing through this right knee. I'm still got pressure on this left side, though. You don't want to go completely off here. I want to put a little bit of pressure on that left knee. Post through here, post through here. I want to think about this rib cage that rotating back to the left. And then I'm going to breathe. And again, if I push too hard, I'm going to shut this stuff down. These muscles are going to get taut. If I don't push enough, I'm not going to activate that muscle, and I'm not going to create space through here. So you kind of have to figure out how much pressure is necessary to open this up, but not to create tension. You want to breathe back into that left rib cage, right around this left shoulder, right below the left shoulder blade into that left rib cage. So that's those, and just even playing around with those would be good. Now, if you want to take it a little bit further, here are some other ones that I like. If you have, let's see, if you have some kind of band, what you can do, I'll just show you two more that I like, that put a little bit more, again, torque on this system. So I like to take, and we played with this, I think, the other day, this left hand, right? Because again, I want to work that left serratus to bring that left rib cage back. I like to go left foot, right? Staggered stance. I'm going to put a soft bend in my ankle, knees, and hips, right on that left side. Soft bend, ankles, knees, hips. Again, I'm going to put a little rounding in that spine with that tailbone drop. I want to reach forward with that left arm, and you should feel that left rib cage, left shoulder blade kind of adhere to that rib cage, right? Think about that rib going back, right? And you can kind of play with the positioning of this. Even this works really, really well. The more I'm perpendicular, I don't know if that's the right angle, at a right angle to the pull of the band, the more rotation I get. The more I'm here, the more that rib cage, the more kind of shifting back I'm going to get. So you can really play with how much of an angle you want, either right at kind of 0 degrees, right in line with the arm, or at 90 degrees. Kind of play around with that and see what feels good to you. Again, same idea as before with that little exercise when you're on the all fours. You want to breathe into that space on the left side, really kind of at and below that left shoulder blade. But that rib going back, tail slightly tucked. I got my weight on that left foot. I'm going to breathe. And when you breathe doing this stuff, exhale all the air out of your lungs. Let it just bottom out. Silent, slow, and smooth. Nice full inhale in through the nose. Exhale all the air out of your lungs. Silent, slow, and smooth. Nice full inhale in through the nose. And I like to do 5 to 8 nice deep breaths, 2 to 3 sets, right? 2 to 3 sets, 5 to 8 breaths. The last one I'm going to show you, I know I've inundated you with a lot, but these are the ones that I use. The last one I'm going to show you is, I use a wedge, but you can use a book if you want. I'll often use a weight with this, but you don't even necessarily have to. So left foot's on the book, right foot's in front into a staggered stance. I'm going to put a soft bend in the ankles, knees, hips. I'm going to push this hip back, right? This left hip, I'm going to push it back. It's like I'm trying to stretch out my left back pocket here. All right, so I'm hunting for that stretch first. That's the first thing I'm going to do. Stretch out this left back pocket. I'm going to take my right elbow, right forearm, really place it on my thigh. I'm going to pin that left arm down, or the left leg down with this right arm. So again, I'm really trying to open this up back here. Then what I like to do is I'll place my hand here, and as I'm gently pushing back, finding the stretch, I'm gonna keep a tuck in the pelvis, and I'm gonna start to gently rotate and look back over that left shoulder. Be gentle with this. Again, you don't want this, you want this. Rib gently down and rotating. But what tends to happen? When you rotate, we tend to shift away. Don't shift away. Think about the butt going back, right? Don't lose that stretch. Same thing, hold it for like 5 to 8 nice deep breaths, right? So once again, right, staggered stance, push the hip back, forearm, elbow, or elbow, forearm on the right thigh, pin that knee down, hunt for the stretch first in the butt, almost like you're trying to separate your sacrum, your tailbone from your hip, right? And then a little tuck in the pelvis, think about that rib cage going back, and just breathe. You want this tension here, not here, really. You want to be able to breathe into this space. And just focus on that breath. Same idea, right? 5 to 8 nice deep breaths. I'd stick with like 5 there because it's going to be pretty intense. Like 3 to 5 sets of breaths. I hope that's helpful, Paymaneh. Let me know how you're doing. Keep me posted. If you have any questions about any of this stuff, please don't hesitate to ask. Also, again, if any of it contradicts what Nikki has you doing, default to Nikki's recommendations. Right? This is my approach to what works for me and my body. She knows far more about what's happening for you, and this is her wheelhouse. So default to her. If you have any questions, don't hesitate to reach out. Hope you're doing well. See you tomorrow, and we'll talk then. All right, bye.